Good morning, YouTube. It's New Life for Jen, or Jen. Today is Thursday, May 24th, 2011, or 2012. Oh my goodness. Let's see. Let's go over the numbers. Starting weight was 264.8 on March 1st, 2011. Surgery was March 18th, 2011 in Tijuana, Mexico. And this morning I was 130.8. So, I came back from Vegas and I weighed in at 134 something. The next day I lost, it's slowly just been dropping. So I'm coming on real quick to give a quick update on that. And I'm going to also do another video just on Vegas itself. But I just want to talk about a couple things in this one and then I will do my Vegas one. Okay, so like I had stated in my last week before I went to Vegas recap, I was concerned about continuing to lose. I've spoken to my regular physician. I have spoken to my Lapband doctor. I have spoken to 2 plastic surgeons from the meet and greet, and they think that I'm still just naturally losing. Do I want to lose anymore? No. But here are my options from what my Lapband doctor told me this morning. Either I can get an unfill so that I will be hungry more and can consume more calories, or I have to like totally chill out on my weight training. And I don't want to do that. The Lapband doctors in Mexico, or the Lapband doctor from, not the Lapband doctor, the plastic surgeon from Mexico, and I had an appointment with Dr. Michaels. I did have one with Pickard and Katzen, and the times were all screwed up from what I had originally set up my appointment for, so I couldn't get back in time to do them, which I was really disheartened because I wanted to especially have Dr. Katzen look at my issues. But they were both very, very, very pleased on how well I've formed my body with this weight training and how less fat I have, and I really just have skin left. So I really don't want to give that up because I have great tone in places that I wanted to do it in. And if I give it up, you know how that works, it starts getting flabbier. I don't want to lose my arms. I want to keep them as fit as possible. I'm not trying to be bodybuilder or anything. I want to be fit, and I feel right now that I have a pretty good fit look, and I want to just keep that. So that's not an option. I don't want to give up the strength and weight training. He said decrease cardio, which I haven't really done any cardio since before Vegas. Just the normal running around all the time like a chicken with my head cut off. But I want to do the C to 5K. So I'm thinking that either, here's my 2 options. I need an unfill. I'm not going to quit strength training, so I either need an unfill or I need to quit smoking. I don't know, for those of you that saw me in Vegas, I have said before in my videos that I smoke. That is something I never gave up. I was never told to quit before Lapband, so I didn't even quit for that surgery. But I know that both of these doctors, the plastic surgeons, stated you will quit smoking months prior. So I want to quit anyway. I mean, I'm on that fence where I want to quit, but then I don't. But I know if I quit, my hunger is definitely going to increase, so maybe that would help keep my weight maintained. So I made an appointment with the regular physician today to go in and speak to him about Chantix. I don't know if any of you have tried it. We know people here that have had great results with it. It does play with different receptors in your mind or your brain and can cause side effects. But, you know, I'm the type of person where if it's causing me bad side effects, then I'll be done with it. But, so we're going to go in at the end of next week, talk to him about that. Hopefully we'll be able to go on that pill, my husband and I. And then maybe with the quitting smoking, that will definitely increase my appetite and that'll help me maintain my weight. So, that's the weight thing. So, I'm thinking maybe I'm actually going to see 120s because I don't know, just because I can't sit still. I have so much energy all the time, I can't sit still. I mean, the only time I watch TV, usually it's the 11 o'clock news at night when I'm laying in bed getting ready to doze off to sleep. I put my sleep timer on and I, listen to the news and fall asleep. But I do say, though, that I have substituted YouTube and Facebook for TV time. I know some people say, oh, I'm not on it all the time, but I mean, if you calculate how many minutes and stuff you're on, it's a lot. So maybe I don't know. I don't even know where I'm going with this, but I'll give a quick recap on what the plastic surgeons told me. My first plastic surgeon appointment was on Friday in Vegas, and that was with Dr. Kiros from Cosmed, and his assistant Joyce, and he also had his other doctor there, and I can't remember his name. I had my consultation on Friday. He was very, very, very pleased on how tone everything was. So we'll go top to bottom. My breasts, of course I wanted a lift and an augmentation. He stated to me that my pectoral muscles are very well developed and that a breast implant may be difficult. He can definitely do a lift, and while he's in there, he would see if he could put the minimum, the smallest implant in there. If I just have a lift, I'm pretty much going to be an A to a small B, he said, without putting an implant in. So I would hope that I would be able to have some kind of implant. But like he said, for them to sit right and look right, he has to be able to put them under the muscle and so that they'll fall correctly. And I was just floored. I'm like, you got to be kidding me. I can't even get an implant. So we'll see what happens. He said that will have to happen as we go through the process. So then we went on to the stomach area. I know I did my skin video and you guys have all seen my stomach skin. I have reduced a little bit because of that Back to Basics challenge. I did lose like an inch in my waist. So I don't know if that was skin or whatever fat I had left. But I do have, at the base of my butt, more or less, where the circular part is, I have like layers, like lines of skin. Sags of skin. Probably like 4 or 5 of them. So I thought that I would be able to do like an extended tummy tuck, where they would lift my stomach and then extend it around to the sides, pull up on the outer hips, and I would be good. But no, he said a 360, and I just about hit the floor. I just couldn't believe it. I don't know mentally if I'm ready for that. I don't know. And then, of course, inner thighs. So I was to me, I'm the type of person that I can read somebody just by their texts, by their posts on Facebook, meeting them in person. I can read people, and I know that feeling. And with him, as soon as I walked in the room, I felt comfortable. He seemed like a fantastic man. His staff is very, very nice. And I have no issues with going to Mexico due to my Lapband being in Mexico. So that went wonderful, wonderful. Saturday I had my same, kind of consultation with Dr. Michaels. He's out of California. He said the same exact things. Great shape on your body. He's telling me that after surgery I would weigh like 115 to 119 pounds, which is something I'm not trying to go for. I don't think I have that much in weight on my skin anyway, but that's what he said. Dr. Hero said, though, the Mexico surgeon had stated that he can almost make me with no stretch marks left. So that would be phenomenal. And I told him straight up, I am not looking to wear a bikini. That's not what I'm after. I am after just getting rid of the skin. But he's like, oh no, this body's going to wear a bikini and you're not going to have any stretch marks, which makes you feel good. But, that's not really what I'm chasing after. Because I know to a lot of you, you probably think, oh my gosh, she looks great, she don't need any plastics, but to me, these are the things that bother me, and if I've went this far in my journey, and it's not going to hurt our family financially to do it, and my husband supports the fact that I want to do it, financially, then I'm probably going to go for it. Dr. Michaels, He said the same thing about my breasts, said the same thing about a 360, because I kind of wanted to get that second opinion with that 360, and he verified and said the same things that Dr. Quiros did. So that all went great. I have not gotten a quote from them, so I have no clue how much Dr. Michaels would be, but I was very happy with my quote price from Dr. Quiros. I did email them yesterday, and I asked if, because he had told me I could do all 3 surgeries at the same time. My breast lift and augmentation, if he could do it, 360 and inner thighs. And he said the reason why he could do all 3 at the same time is because I have such a low amount of fat on my body that it would be very less bleeding. So he said that I would be a great candidate to have all 3 done, that I would heal very well, all that good stuff. But I am not mentally ready for the 360. That, I'm sure, is some deep, deep mental preparation, which I have not done. The 2 most parts of my body right now that bother me the most, of course, are my breasts and my inner thighs. But the 360 is the one that'll help with the outer thigh. So there's just a lot to sit and think about. But I did send him a message, Dr. Quiros, and asked him if we broke it up and let's do the inner thighs and the breasts. You know, I wanted a cost on that, recovery time on those 2, how long I'd have to be in Mexico, how long I'd be down for work, and then maybe I'll work on the 360 next year. I don't know. I'm just having a lot of, like I said before, I can't sit still. I just can't picture myself laying in a bed for a month or 3 weeks, you know, and I'm not just saying laying in the bed, because I know you're going to get up or whatever, but being sedentary and not, I'm a pusher. I will push my body. I will push myself. So, I don't know. We'll see. But that's that. Very, very happy with Dr. Quiros and his staff. And Cosmed looks like a beautiful clinic. I did go to his seminar on Saturday. You know, I don't have any fears with Tijuana. I know a lot of people do, but I know exactly when he spoke in that meeting about the safety of the patient and the care that they give those patients, that's what they're doing. They truly care for you hand and foot. And I know when Sally made her videos, I remember her saying that the ladies were bringing her some kind of cookie, and it's true. There's a different level of care, and it's not, you know, downing the U.S. It's just a different concept there. But anyway, I am rambling, and I am so sorry. But I will be doing my Vegas update. I hope you guys all have a great day. And that's my week 5th. Oh, Lord. I don't even know what week I'm on. 61, 62, somewhere in there. Post-op Lapband update and plastic surgery update. I love you guys. I will talk to you soon. Bye.